Salam guys, this is Sama from UNZOS and today I am starting a series of some historical events. It includes different historical personalities, historical events, etc. So along with other technology information and some tricks, I shall continue this series and today I am making this video on one of the greatest surgeon in the history of world. Indeed, he is considered as a father of modern surgery. So without wasting time, now come towards video. So guys, here is some introduction of Abul Qasim Al-Zahrawi, Albucasis, pioneer of modern surgery. Abu Qasim Khalaf ibn Abbās Al-Zahrawi, known in the West as Albucasis or Zahrawius, was born in 936 Anno Domini in Al-Zahra, a suburb 6 miles northwest of Cordoba, the capital of Muslim Spain, Al-Andalus. His ancestors were from the Al-Ansar tribes of Al-Madinah Al-Munawwara, who came from the Arabian Peninsula with the Muslim armies which conquered and lived in Spain. Al-Zahrawi traveled rarely and spent most of his life in his hometown as a practicing physician, pharmacist, surgeon. He served as the court physician to Caliph Al-Hakam II at a period considered as a golden age of Arab Spain when natural and mathematical science reached their peak. After a long and distinguished medical career, he died in 1013 Anno Domini at the age of 77. Around the year 1000 Anno Domini, he wrote his famous book Al-Tasrif Liman Ajaz an Al-Talif, the clearance of medical science for those who cannot compile it. It was a summation of about 50 years of medical education, training, practice, and experience. The 30 volumes of Medical Encyclopedia covered various aspects of medical knowledge. In addition to sections on medicine and surgery, there were sections on midwifery, pharmacology, therapeutics, dietetics, physiotherapy, base and measures, and medical chemistry. Al-Tasrif, 3 chapters were devoted to surgery. Some of the procedures and techniques detailed in these chapters include the following: surgery of the eye, ear, and throat. He fully described tonsillectomy and tracheostomy. He devised instruments for internal examination of the ear. He devised an instrument used to remove or insert objects into the throat. He described how to use a hook to remove a polyp from the nose. He described the exposure and division of the temporal artery to relieve certain types of headaches. He utilized cauterization, usually to treat skin tumors or open abscesses. He applied cauterization procedure to as many as 50 different operations. Application of ligatures for bleeding vessels and internal stitching utilizing catgut. He preceded the famous French military surgeon Ambrose Pierre 1510 to 1590, claimed to be the first European to utilize sutures by 5 centuries. Treatment for anal fistulas, setting dislocated bones and fractures. His method for setting and reducing a dislocated shoulder was centuries before which introduced his similar technique to European medicine. Removal of urinary bladder calculi. He advised that the treating physician has to insert a figure into the rectum of the patient, move the stone down to the neck of the bladder, then make an incision in the rectal wall or the perineum and remove the stone. He devised instruments for inspection of urethra. He is credited to be the first to describe ectopic pregnancy. He devised several dental devices and artificial teeth made of animal bones. Al-Zahrawi is considered the father of operative surgery. He is credited with performance of the first thyroidectomy. The last chapter of his comprehensive book, named on surgery, was dedicated to surgical instruments. He introduced over 200 surgical tools, a staggering number by all standards. He gave detailed descriptions of for using props, surgical knives, scalpels, and hooks. He also devised and invented surgical scissors, grasping forceps, and obstetrical forceps. His illustrations of surgical instruments were the earliest intended for use in the teaching and in methods of manufacturing them. Abdul Halim et al. Gave a detailed study of al-Zahrawi's technique of cystolithotomy after inventing operative instruments not known in the Greco-Roman era. They reviewed his operative technique in the woman, his recommendations of two-stage operation in complicated cases, and his contributions to lithotripsy by introducing a crushing forceps, al-Khalaf forceps, and a driller fragmenting forceps, al-Mishab, to remove impacted stones. Al-Zahrawi contributed early descriptions on neurosurgical diagnosis and treatment, including management of head injuries, skull fractures, spinal injuries and dislocation, hydrocephalus, subdural infusion, headache, and many other conditions. He described vividly a case of hydrocephalus due to congenital defects of drainage of cerebrospinal fluid. I have seen a baby boy whose head was abnormally enlarged with prominence of forehead and sides to the point that the body became unable to hold it up. He was the first to describe in detail the medical aspects of hemophilia. In addition to his description of hydrocephalus, he described hair lip adenoids, ranula, imperforated external urinary meatus, perforated anus, hermaphroditus, gynecomastia, supernumerary, and webbed fingers. His medical writings were highly regarded in the West, particularly after being translated by Gerard of Cremona, Rogerius, Frugati, Ronaldus, Parmensis, and others. His surgical techniques were the most advanced in the medical ages until the 13th century. Al-Tasrif was an essential component of the medical curriculum in European countries for many centuries. The famous French surgeon Guy de Chauliac, 1300 to 1368, quoted him over 200 times in his book, appended its Latin edition to his own book on surgery. Several editions of this book, surgical chapters, were published, including one at Vienna 1497, at Basel 1541, and at Oxford 1778. Finally, he emphasized child education and behavior, school curriculum, and academic specialization. He advised that gifted and intelligent students be encouraged to study medicine after completing their primary education in language, grammar, mathematics, astronomy, and philosophy. This article is just a glimpse of the medical and surgical contributions of this great Arab physician from Andalus to the world. Article is information is Dhahran Health Center, Saudi Aramco Medical Services Organization, Dhahran, Saudi Arabia. So guys, hope so you have liked this video. So please like and share this video and subscribe my YouTube channel. Take care of yourself. Allah Hafiz.